So I met Nikki about 5 years ago, and at the time I was sort of edging out of the NHS. I worked in the NHS and public health services in Ireland for 22 years now, as a doctor, a psychiatrist latterly, and a therapist. And I had this inkling not long after I qualified that became a kind of an intuition that sort of then kind of curdled into a sort of a conviction that a lot of what we were doing was kind of window dressing at best and harmful at worst, and that the effect that I was having on the 10,000 or so patients that I've seen over my career was talking and listening and caring. And that sounds kind of soft, I think, to some ears, but it isn't. You know, it is. It's alchemy. It's an extraordinary thing, and so I sort of became radicalized over the years, I think. And then I met Nikki about 5 years ago, and we had very convergent ideas, didn't we? Not identical. That would be very boring. And after all my talks, Nikki texts me afterwards and she goes, "Well, here's what you didn't say, Iain. Here's what you forgot to say." And we, you know, I think we immediately connected. And Nikki told me about Talk for Health. This idea that was just is so obvious, you know, that not just that the people who care for communities should look and sound like those communities, but that should actually be those communities was an extraordinary thing. And I thought, what a great idea. And I sort of she stole the idea from me like 5 years before I had it myself. And it was really inspiring. And so she brought me into the orbit of Talk for Health. And I started I started attending and giving talks at these events that her wonderful staff run. And it was extraordinary to see these people, you know, these people who the mental health services often hadn't helped. Sometimes they had, and they're wonderful. I've had wonderful colleagues, but you know, it's the system that doesn't help people. And all these people who had been diagnosed with personality disorder. And for those of you who don't know, personality disorder is a technical term that doctors use to refer to women that they find annoying because they're not skilled enough to help them. You know, it was the oldest medical document we have is from 6500 BC, and it's a papyrus parchment which describes how madness is caused by the womb traveling around the body, and of course that's where we get the word hysterical via Greek. And we are not much better in some ways than we were back then. But I met these amazing people, you know, who came together and learned these communication skills. And medicine, psychiatry, prior to, you know, we have simple solutions for complex problems. And that doesn't work. But communication is not a simple thing. It's a complex thing. It's incredibly rich. And community is not a simple thing. It's a complex thing. And it's incredibly rich. And so this is a complex solution for complex problems delivered by the people to the other people who suffer because of what they've been through and because of the kind of world that they live in. And it is really an extraordinarily magical thing. I'm very, very happy and glad that I met Nikki. And that I met all of the people that I've met in Talk for Health. And Gabriel, I've heard a lot about you. I didn't know you were an AI expert.
I'm not.
And so I'm very glad. And every time I teach communication skills to new team members who come on site, I always think of Nikki. And I always think of the richness of what she has built. And it's an extraordinary thing. And I'm very happy to be here. Thank you.